So once again, I'm going to do tracheostomy care. I have made sure that the patient is comfortable and they've been suctioned, they're not in any pain. I want to make sure that I have all the equipment that I need. I have my mask in place. I have a trach tray, a chucks, a tracheostomy holder, peroxide and normal saline. The first thing I'm going to do is I'm going to put the new trach holder behind the patient's neck. Here we go. And I'm just going to leave that there. The old one is okay. I'm going to loosen up this collar a little bit. I'm going to put the chucks right under here in case we make a mess, and we most likely will. I'm going to open up the tray. I'm going to grab the sterile towel. I'm then going to place the contents of the tray on the sterile field. Then I'm going to fill up and then I'm going to use, that was normal saline, this is just some peroxide, and that'll help to loosen the secretions. If I need to change the dressing, which I'm going to for this purposes, this is when I would start to loosen and also loosen this trach ties. I'm not going to let it go 100%, but I'm going to loosen it up so when I'm done, I can just put the new one on fairly quickly. So I'm going to take this out, throw it in the garbage. This is when I'm going to remove the inner cannula, and it's a counterclockwise turn and a pull, and I'm going to drop it into the saline and peroxide. Okay. I'm going to pick up the cannula with my left hand. Here's a little scrub brush. I'm going to scrub the mucus and the blood out of here. I'm also going to scrub anything on the outside that might be. I'm going to rinse it off in saline. I'm going to put this right there. Now, I can use these Q-tips. This is the saline that wasn't used on anything, to clean around the site, going from in to out. In to out. And then I can place my new dressing on. If you have help, that's lovely. If you don't have help, you need to be very careful that you don't rip this tracheostomy out. So the new dressing is on. I'm going to stabilize it with my 2 fingers. Oh, for gosh sakes. Pull the old one out. Velcro's working pretty good. Now the variation of this would be if you did have an assistant, the assistant could help you stabilize the faceplate while you put the new holder on. I just like to do it with my left hand because my left hand is my non-dominant hand. And again, this is a situation that once you put your hand down, it can't ever come up. Otherwise, you risk cross-contamination. So there we go. That's it.